Hi, my name is Misty Richmond. I'm a PhD student here at the University of Cincinnati's College of Nursing. I'm a Jonas Scholar, and I'm also the GNSA Liaison here at the College of Nursing. It's my pleasure to introduce to you Dean Glazer, who's the Dean of the College of Nursing, and who has agreed to participate in this interview as part of the Leadership Project for Nurses Week. First of all, I want to thank you for agreeing to do this with me today. I know you have a very busy schedule. And I think the first thing I need to ask you, or the first thing I would like to ask you, is to just explain what your title is at this point in time, and maybe a little bit about how you came to the position that you're in right now.
Okay. So I have two titles. One is Dean of the College of Nursing at University of Cincinnati College of Nursing. And the second title I got after I'd been here a year. And I always have to check it because I'm not one great with titles, but it's Associate Vice President for Health Affairs. And that is a really exciting title because it means that I am influential in policy development at the academic health centers.
I was just going to ask if that's the university or if that's the medical center.
It's the part of the academic health center, and there's four colleges here: the College of Medicine, Nursing, Allied Health, and Pharmacy. So we've got the four academic health center colleges, and when I got here, there hadn't been a whole lot of collaboration and partnership between people within the different academic health center colleges. So the idea was, let's formalize a structure, and let's develop a plan of how can we do a better job of working together. So I'm excited because I have the title now of Associate Vice President for Health Affairs. It gives me legitimacy in terms of title to be able to work with the other colleges to figure out how can we do a better job of educating our students to be able to do the work that's got to be done. And we know it's not going to be done in silos. We got to be doing it together. So it's exciting.
Well, and frankly, that's part of the reason why I was excited about being able to interview you, because I have some knowledge about the issues that have been here. I've been here a little bit longer than you have as a student, and I know that it was something that you were interested in taking a look at here as the dean. I'm also aware that you've, can you tell a little bit about volunteer positions in terms of nursing leadership? Maybe your work with the ACN or any other positions that you've held that might be interesting in terms of leadership.
I thank my undergraduate and graduate schools for socializing me into what it takes to be a nurse leader. And so I have my undergraduate from Michigan, University of Michigan, and my master's and doctorate from Case Western Reserve. And actually, being here now at UC, our motto is, you see nurses, we see leaders. So it's all about being a leader. And so to be a leader, it means that you've worked to develop a certain skill set that will apply no matter where you are. You can be in any role, but those same skills of being a leader apply. So, I mean, starting from the very beginning, after graduating nursing school, I joined the Ohio Nurses Association, American Nurses Association, Greater Cleveland Nurses Association. And it's okay to just pay your money because these membership organizations need money to be able to do their great work, but you can learn so much by being an active member of them. So I actually joined the legislative committee at Greater Cleveland Nurses Association and worked my way up from member to the chairperson, and then went from the local level to the state. So I was then the state chair, and then ultimately ended up as the American Nurses Association Political Action Committee chair.
Oh.
And so you have to do your due diligence. You've got to work your way up through systems to try to make yourself competitive for those higher levels of leadership. But it starts with being a worker bee and then showing that you can actually do the work. And I've been really surprised over my career how many people come to meetings not prepared, how many people just show up and think that's what they need to do. I've always been taught you're always prepared for everything you go into, and you find out, I look like you're going to say something, you find out if you're prepared, you're probably going to be able to help move your agendas forward because you're ready.
Well, the only thing that came to mind was I'm nowhere near as experienced as you are by any means, but I've observed the same issue in the experience that I have had, that unfortunately too many people don't come ready to work, ready, knowledgeable about the topics and the materials, etc.
So I'll just say something about that. So as a leader, part of your role as a leader is to set ground rules for membership and for participation. So in every group that I've worked at, whether it's been a volunteer group, like those legislative committees or the political action committees, or whether it be as a faculty member at a college when I've been a dean, we've got ground rules. And part of the ground rules are, I agree that I'm going to read everything that comes to me before. I will have my materials a week in advance, and I'll be ready for the meetings, because if there's one thing I personally dislike immensely, I don't want to be talked at constantly of things that I could have read. What I think meetings are for is to discuss ideas and to have as much dialogue as possible so that you're able to really have a great discussion on all the different points of views, and I want to hear all the different points of views that are educated based on data, and that together you'll come to much better decisions when you got so many voices heard.
And you feel like you were taught that starting with your undergraduate? Is that what you said?
I hate to admit it, that's so long ago. So I can't guarantee that it happened when I was in my undergraduate. But what I will say that was indoctrinated was, you're a member of a profession. This is a profession. This is not a job. This is a profession. And your responsibility as a professional is to be a member professional association. So it was never a question that I would not join the professional association, and that still seems to be a pretty rare thing. The majority of nurses are not members of the Professional Nursing Association.
I was just going to bring that up in terms of significance and impact on the profession and on healthcare in general. If you have any thoughts about what impact the lack of involvement has, perhaps, or what difference it can make if there were more involvement, to take a positive.
A very tangible example, and I don't think most nurses don't know enough about this. I think we've got to do a much better job in education. Most nurses don't get a great education in the policy arena, and we have to do a better job for undergraduates, and then graduates, advanced, but undergraduates. Anyways, a huge impact that groups have is through political action committees and who they can endorse and don't endorse, and then those people become our legislators. So the only way political action committees can raise money is from their own members. So the fact that less than 10% of nurses belong to the American Nurses Association means that you can't even ask 90% of the nurses to contribute to a political action committee. Therefore, if you were to look and see how much money is donated to campaigns, you'll see that Nursing Association is way down there compared to other groups. So you wonder why the American Medical Association, is one example, has a little more clout. It's because they give more money to candidates, their candidates get elected, and then they've got an ear to hear what their issues are. So that's a tangible example that, I believe if we had more people that were members of the association and were doing a good job of educating them about why we need to have donations, and I think we'd have a lot more clout and a lot more ability to influence people that are making decisions.
In particular, I think since there's over 3 times as many licensed RNs as there are licensed physicians in America, it just really highlights the lack of the problem, I think. How do you see this, your work, in terms of this in the future?
Well, one thing that was surprising to me when I got here at the University of Cincinnati. We have a student association, but they're not part of the Ohio Student Nurses Association. It's a separate entity. So I can tell you for sure, next fall, we're going to start a chapter of Ohio Student Nurses Association here at University of Cincinnati, because one of the greatest benefits of being a member of any of these is the networking. To network with other nurses, other nursing students that are going through very similar things that can help you to get to the next level, help answer questions, provide mentorship, provide information. It's so critical. And so that would be one thing for sure we're going to be doing here.
No, I think that's a great idea, especially as president of the Graduate Student Association here. I'm not sure that I even have much awareness that Ohio Student Nurse Association exists.
I think it's just for undergraduates, so I don't think it's for graduates. But even so,
still, yeah.
I mean, we should be part of a larger. There's always part of a larger group that we can be part of, working together for the same goals and synergize. So, yeah.
And I see the connection between all of this and actual health care, but perhaps you could, just for purposes of the interview, draw that connection for people in terms of what might it mean for healthcare in America if nurses were more involved in their organizations and paid more attention to policy issues that happen as they come up.
Okay. So I could answer that in a lot of ways, but one important way is our practice is all regulated by state law. So right now, we've got state laws in all 50 states that differ. They are not the same. And so at the state level, how important it is for nurses to be able to influence the Nurse Practice Acts so that nurses are able to function in the way that they should be functioning in the healthcare system. So first of all, scope of practice is defined in the Nurse Practice Acts. If it's not in the Nurse Practice Act, it's beyond your scope of practice. And so a good example of that is with advanced practice nurses right now. We know we don't have enough primary health care providers. The solution, one solution to the primary health care shortage is to have advanced practice nurses and physician assistants being primary care providers. If you don't have in your Nurse Practice Act, first of all, title protection, that you've got nurse practitioners in the law, and then their scope of practice is defined in a way that is very restrictive. So in Ohio, right now, nurses cannot practice independent. Nurse practitioners cannot practice independently. They need physician supervision, and they need prescriptive authority that's supervised by physicians too. There are 13 states that don't have that. It's a very different way of practicing in these different states. So that's a very good example of right now in the United States, we know we have so many people that cannot get primary health care in a timely way. We could solve that issue right now if we opened up scope of practice and let nurses practice to the highest level of their education. And if the nursing lobby was stronger, we might be able to get there a little more quickly.
I'm tempted to go off script a little bit and talk
That's
about
fine. We could go off script.
Well, the VA's initiative right now to update their nursing handbook. Which actually I know some of the state coalitions are being asked to send letters in support of that. Because actually what they're talking about doing isn't anything that the Department of Indian Affairs and the Defense Department have already done with nursing scope of practice in terms of the nurses who work in those organizations. So I think it's just the time is right now, I believe. And sorry, I guess that was more of a statement than a question.
I'm glad you said that, but that actually brings up a really important point. One of the reasons why you have to be a member of the professional association is to get information. Probably the majority of nurses have no idea what's going on right now with the VA system. And if they knew, they would want to be vocal about why we need to be able to allow nurses to practice independently. So that's one thing you get when you're a member of the professional associations, whether it be the American Nurses Association or the AACN. AACN's got a whole government affairs group. I was on that committee. I'm now on the board. I know at our last AACN meeting, all the deans are asked to go visit their legislators on Capitol Hill. We had a little description of what the VA was proposing, and we spoke with our legislators about that. But it happens best when you have everybody speaking with the same voice, people have the facts, and then they've got a feedback loop to somebody to follow up. That's another great reason for being part of groups.
Well, I think it has been another criticism of nursing as a profession as well, that we fail to coordinate our message clearly with either the public or policymakers, etc. Did you have anything else you wanted to say about policy issues, or I was going to ask you about any other aspects of nursing leadership that perhaps you wanted to talk about?
I mean, I want to make sure that I mentioned policy issues are not just law, right? There are all kinds of policies that are formed at our individual work sites, and there are rules that are written that make more difference than the actual law. So it's just really important for us to steep ourselves in as much knowledge as possible so that we're able to impact the policy development cycle. And like, I'm excited because right now I'm working with one of our DNP students on her capstone project, which is trying to change policy related to AEDs in academic settings. So it's policy development from the beginning to actually watch how it then gets implemented and then evaluated. You know, we've got that whole cycle here that we've got to understand. It's not just one part.
You talked about the fact that a lot of nursing colleges or colleges of nursing don't necessarily do a very good job about educating at undergraduate and graduate level about policy issues. Do you have any plans to look at that in terms of the University of Cincinnati's College of Nursing and the programs here, or the classes that are taught here?
Well, we do know that there are essentials of all of the different programs that AACN's
it's an additional thing to add. Yeah.
So we're making sure that all the time our faculty are taking a look at those essentials and trying to map what we're doing at the various levels. We'll continue to do that. The part that I think would be really exciting would be to figure out how we integrate policy into people's research, people that are doing PhDs. How do you actually move from a huge dissertation that's hundreds of pages to actually maybe developing policy related to what your research findings were?
I love that.
Working with other disciplines to look at policy. When I was at UMass Boston, we had a whole college of public policy. I'm sure most universities have divisions. Why aren't we working with those groups to try to figure out
great question.
How we can? So I'm all for looking at working with experts, figuring out how we can learn from each other and make sure that we then are attending to, from policy development through policy implementation through policy evaluation, how we're working through these things on everything that we're doing.
Do you see any of this playing out in terms of an effect on health outcomes?
I think it has a direct link to health outcomes. Yeah, I mean, there's a direct link. The idea is, the best example of that really is Linda Aiken's work at University of Pennsylvania that looks at educational preparation and then mortality and people that her work looks at the workforce, nursing workforce, and outcomes, and she's got really good data that shows the more educational preparation that people have, the better the outcomes. Oh, it was failure to rescue.
Yes.
Yeah.
I was going to say I've actually used, I know at least one of her articles in a presentation I'm doing this afternoon, actually. Mm-hmm. Okay, I knew the name was familiar.
Yeah, so there's a direct link that a lot of people are finding. There's direct links about having nurses that are prepared at the master's level, providing home visiting, to mothers, new mothers, and that making a difference in health outcomes later. But what we need to do, I will say, and this is for the future, I know you're going to ask me a little bit about the future, we need to be able to link what we're doing to outcomes, but what we've not done well, and we have to do it, and it does have something to do with curriculum, we've not done much about cost. We have got to be concerned about the cost of things. So I urge everybody here that if you're doing capstones, if you're doing research projects, that you actually figure out the monetary part of it. How much money are you saving by doing what you're saying? What is the cost of the programming you're expecting? So that we actually understand the cost consequences, because we need to be concerned with the triple aim. Got to be concerned about quality. We've got to be concerned about patient-centered care and patient satisfaction. But cost, we cannot continue to have our costs rise in healthcare as they have been. So what are you proposing, and what's the cost? That would be a great addition to almost all the work that our graduate students are doing.
I think that's great advice, too. Anything else that you would like to share, perhaps, about the University of Cincinnati's College of Nursing and what the program here is doing in terms of scholarship and or research that you think will impact on nursing leadership in the future? If there's anything you'd like to add.
Well, I mean, what we're doing and what we've done that I think is something that's been very helpful, we have a strategic map that's one page. So everybody knows where we're going and what we're doing, and we know that we cannot be the greatest research institution at everything. So we're really trying to narrow down what is our focus, what are we doing, and actually I'm excited next week. One of the strands that the university has decided to focus on, they also have come to the same conclusion. So University of Cincinnati will be known for 6 areas of research. Wow. One of the areas is health, and included in health is disease and illness, but health is one. Well, the College of Nursing is leading the discussion on this next week. We've got over 100
Excellent.
People from all of the colleges at the university with representation from all, which is 15, coming to discuss, all right, now within health, what subset of health are we going to be known for at University of Cincinnati, understanding that it's not going to be any one college, that it's got to be a collaboration amongst various colleges, because it's just too complex now for any one group to just be doing research by themselves.
How did it come to be that nursing is leading the discussion on that, if you don't mind?
I have a great research dean. What happened is, I actually, when I got here, I tried to assemble the best leadership team I could. And I've got 3 associate deans. One of them is the dean of research, one of them is dean of academic programs, and the other was a position I created anew, which is clinical practice partnership and community engagement. They lead their efforts in their areas. So Donna Martzoff is my associate dean for research. She's taken her position very seriously, is not only leading the College of Nursing, but we are trying to lead the transformation of healthcare in partnership with those we serve. So as that vision that we've got, she's making a very serious attempt to work with people across the university, and why shouldn't nurses lead? Didn't the Institute of Medicine say we need to lead teams?
Absolutely.
We're not just members of teams.
No, I think it's wonderful.
So we're trying to live.
That's frankly why I asked.
we're trying to live by example here.
Absolutely.
We're trying to
It's
live
wonderful.
by example and say, you know what, we're all leaders. And that really is another message for you. Everybody's a leader. It's not just positional. It's not just your title. Everyone is a leader. And so I want to leave you with a few things, advice for the next generation of leaders that I took a few notes on. First of all, and the most important message is you, whoever you are listening to this right now, you can make a difference. One person can make a difference. What I think happens so much is everybody looks around and thinks it's going to be the next one to do it. And if you just think to yourself that I personally have a stake in this, I'm passionate about what I do, and I'm going to make a difference, if we all think that, we are going to be able to do everything that we ever tried. So don't think it's the next person. Think about it for yourself. Then I wanted to say that whenever you're trying to make decisions, it's not easy. It's hard to lead. It's hard to be a leader because everybody is not going to agree on everything. if you just do the right thing. That's got to be what your bottom line is. What is the right thing to do? If you get to what the right thing to do is, you're always going to make the right decision, and you cannot be worried about people liking you. I think that a lot of nurses, because they're so much into helping and they're very altruistic and they're mostly really wonderful people, I think they're well liked by lots. We know they're the most trusted professionals, but most nurses probably are liked by a lot of people. It's very hard for nurses not to be liked. But you're never going to be a great leader if you're just worried about what people think of you. And so, you know, what I've always tried to use is my most important yardstick is to say, I'm not going to worry about what people think of me. I'm going to do the right thing. The other thing that sort of goes along with this is we're always going to have disagreement, and we won't always agree on everything. But we will have some things we can agree on, no matter what the issue. So whether we're working with groups of nurses or we're working with other people, I think what we need to do is focus on what we can agree on, and then we'll deal with everything else. Last two things is inaction is action. If you do not act, that has consequences. And so it's far better for you to act and then deal with the consequences than not act and have things just happen to you. Last point, everything that we're talking about doing here in healthcare as nurses, and what we're talking about is not a small change. We're talking about a transformation of healthcare, and we want to be the leaders of that. It takes partnership and collaboration. We have to figure out ways that no matter who we're talking about, even if we've got sharp points of disagreement, that we find the ways that we can interface, we find the ways that we can collaborate, and we partner to create this better future that we know that we've got to have.
Dean Glazer, thank you so much for your time. I really appreciate it.
You're welcome.